right into this one with our ABC News medical contributor and physician at Standford Children's Health, Dr. Alok Patel. Good to see you, doctor. So the CDC is now acknowledging COVID guidance was, quote, confusing and overwhelming, now committing to institutional changes. What do you make of this accountability?
Well, what I make of this is that this has to happen. And I don't think this is a surprise to anyone out there. And the CDC has been mulling this over for quite some time. We know this internal review actually was started in April. And one thing that comes out front and center is CDC Director Walensky's emphasis on just creating relatable, translatable, actionable items, things that they can get out there to the public so they can make the best decisions for themselves. There's a lot of shifts in place. I think it's all moving the right direction, but what we want to see is the actual plan, the protocol, and then to see if this is actually going to play out in real time.
Yeah, and many will point out that the confusion at the beginning of the pandemic gave the political fodder a little bit more juice because there was so much confusion about what the CDC was putting out. Did you find among your patients that the CDC guidance during the pandemic jeopardized the trust people had in public health officials?
Well, Kenneth, it absolutely did, because patients were hearing mixed messaging about things like whether or not COVID-19 was airborne, when to wear a mask, to tests that weren't working, and we're having trouble actually finding information that spoke to them. You're absolutely right. Public health has become a little bit more politicized than it was in the past. But also, if we look at the CDC's response in previous outbreaks, H1N1, Zika, Ebola, Kenneth, we're in a completely different era now with social media and information moving faster than public health officials can even keep up with. So if one little piece of information gets out there before the scientific community can kind of rein it in and say, let's explain it to everyone, people are already taking steps and acting in a certain way with that. So I think the CDC is finally realizing they need to move a little bit faster in response to everything that's actually happening.
Okay, so the CDC director, in her very blunt statements, she's promising to make changes to the CDC website, staffing, and in the way they share information. So the question is that enough? I know you have a full-time job, probably a couple full-time jobs, but if you were the CDC director, what action would you take?
The first thing that I would do, which she recognized and says that she's going to do, is making pre-print studies available for people and putting out good information so people can make actionable items. Translation, during COVID-19, we saw this unprecedented flood of these preprint, non-peer-reviewed studies come to mainstream media and social media. And people were saying, look at this study. This is what I now believe regarding COVID-19, the vaccine treatments, whatever. Whereas the CDC traditionally takes a more academic, scientific approach. They do a lot of data gathering, and then they put out a statement. And oftentimes that statement is late in comparison to what the public is already doing and hearing. For example, recently with polio, we've been talking about the outbreak in the wastewater cases in New York City and the individual who contracted polio. The CDC had information about that back in June. So there's clearly a little gap there. And I think that's exactly what they're trying to pinpoint right now. Maybe they need to hire like a young team of social media savvy kind of entrepreneurs and just kind of tackle on scientific communication.
Yeah, the information's got to be up to date. I remember sometimes we chatted and I felt like some of the information was old, or you say the last time they did this, it was, study this, it was a few years ago, whatever. But let me move to monkeypox, because now we are dealing with this monkeypox virus and people, if there's this mistrust of the CDC, how is that going to hurt things? I mean, is the CDC, are we repeating the same mistakes from the past with the response to monkeypox?
Well, it almost seems that way, Kenneth, with respect to how long it took for the CDC to really come out there and say that this is a public health emergency and give us good information. Now, I think people need to understand that CDC Director Walensky called for this review before the first cases of monkeypox. So it's not some reaction to criticism for its response to monkeypox. I think that's important to clear up. But also, if we go back to previous times, regarding for H1N1, for example, when the director at the time, Richard Besser, was on TV every day and just speaking directly to the American people. There was no long presentation. There was no scientific jargon. I feel like that is an approach the CDC is slowly going back to with respect to monkeypox. The videos, at least that I have seen, the informational videos, seem more relatable in more lay language so people know exactly what's going on. And I think that's exactly what needs to happen, not only with monkeypox, but with all future outbreaks.
And doctor, these breakthrough cases, after people have gotten the monkeypox vaccine, what do you make of that?
What I make of that is this kind of speaks to the fact that no one ever said or thought that the vaccine for monkeypox was 100% effective. This is based on data for a vaccine that was originally designed for smallpox. And we're learning in real time just how effective it really is. Is it 70? Is it 80? Is it 90? So it's not surprising that there's going to be some breakthrough cases. We want to know more about those specific cases. Was it pre or post exposure to monkeypox? And we'll go from there. But the recommendation still stays the same. Get tested, get vaccinated, especially if you're vulnerable or at high risk.
All right. As always, friend, I appreciate your expertise. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.